Hey folks, Dr. Marcus Johnson here, physical therapist, and I want to talk to you today about my review for the Acute Care Therapy Crash Course for physical therapists who are either students starting their acute care rotation, or maybe you're a physical therapist starting your first acute care job, and maybe your clinical and acute care was a while back, or you just want to make sure that you're up to snuff and ready for your first day. But also maybe you're a traveling physical therapist and you haven't been in an acute setting in a while. You could also be transitioning from outpatient to acute care. And this is the course for you. It's the most complete, comprehensive course that shows you everything you need to consider, but also down to specific things that you should focus on to be successful on your first day. From what the equipment is, how to approach your chart review, common diagnoses, and how you communicate with the team around you in the acute setting. So just to kind of go over what the website first looks like. Now, if you're not sure if you want to actually purchase the course, although I highly recommend getting the full version, you can check out a free mini course and cheat sheet here if you sign up. And it's a great way to get started, get a little bit of a flavor for what the actual course is. But when you want to really prepare your best for that acute care rotation or new position, you need to take the full course. I really think that it made such a huge difference for me working as an acute physical therapist now. Before I get into that, though, the reason why I took the course was I, as a student, had my first rotation in acute care, and I only lasted 5 weeks because I was essentially kicked out of the hospital at the height of COVID. So they didn't want any students in the hospital, especially in acute care, because my entire floor ended up being like a COVID floor. And my school thought that was inappropriate. The hospital was getting rid of the nursing students and everyone else, and they said, okay, your turn to go too. So I only got 5 weeks, which was really quick. And then I had other outpatient type of rotations that really didn't relate much to acute care, but I knew that I wanted to work in the hospital as my first job after graduation. So what I did is I actually started working in the hospital, and then a few months in, discovered this course and took it not only to kind of make sure I truly knew what I was pretty sure I knew, but also make sure that I got someone else's outside perspective, and someone who's been working in acute care for a while, to make sure that I'm understanding what their perspective is and bringing that into my own practice, even though if I was already doing it, which was maybe another thing, is if you're new to acute care and it's your first job and you just kind of want to check yourself, have that accountability, this is a great course to do that. So let's go through a little bit what the course looks like here. It's approved in states here, including Ohio and Texas. But then there's also these reciprocity states for 9.5 CEUs. So 9.5 out of the 32 that I need in Washington is really great. So I thought that was also a worthwhile investment into my own continuing education early on in my career too. Without really blowing up too much of the specific content, I do want to draw your attention over to the sidebar here. There's 8 modules. There's a nice introduction talking about, kind of what the main tips are, who Kyle is and what he's all about, just so you kind of get to know your presenter. And then it goes through talking about a lot of different things in the different modules, patient care, what kind of different areas of the hospital you might work in, because acute care is not one setting. It's really a lot of different settings within on the acute side of the spectrum of a lot of these diseases. And then he goes into talking about transfers, equipment, lab values. How do you deal with family members and communicate well? And these are all things that really made a difference for me to make sure that I knew what equipment and safety considerations to have, but also how to communicate those things to the rest of the team. And as well as, not communicating even verbally, but in the documentation, because documentation is quite a bit different in acute care. I mean, you still have your basic SOAP outline, but there's a lot of different things that you want to write about that you may not think about, someone's oxygen saturation in an outpatient setting necessarily. You might not think about, commenting on someone's wound or things like that. in the outpatient setting necessarily. So that brings me to the special topics too. So talking about wound care, some physical therapists do wound care. I don't, but I'm often, because I'm on the trauma unit, I'm a trauma PT. I'm often in the room and mobilizing patients right before or after wound care, or like holding a leg while the wound care nurse does that type of care. And then on the higher level too, they go over what ICU is like, and then even talking towards the end about kind of what Kyle explains what his lessons learned were, and also where to find a job, which is really important. So this is a great course. Again, it's really, no matter where you're at, you might think, well, I don't need a crash course, but it's much more than a crash course. It's very thorough and well done. And it was really helpful to me, even though I already had a job, I had a clinical, I was working for a few months. I decided to take it anyway. And I think it really solidified the things that I was pretty sure I knew. And, I want to make sure everyone knows about it. Right now, it's $299.99, $300. And that's a great price for the value that it brings. And I like this type of model too, where you basically pay for it once, and then as it's updated and evolves, you get that access. So you're not paying for higher levels at this point, which is great. So you should check it out. If you have any questions about it, send me a message. The link to take it is below. I have a link down below. So if you want to buy the course, use that CEU money that you have from your employer, and take this course and learn about acute care. All right.